Welcome back to Files and Beyond. Today we will be diving into an essential neurology topic: brain infarction versus brain hemorrhage, two major types of stroke. We will be covering the definitions, causes, pathophysiology, symptoms, diagnosis, treatment, and finally the key differences. A stroke is an acute disturbance of brain function caused by either a lack of blood supply or bleeding within the brain. Globally, stroke is one of the leading causes of death and long-term disability. There are two main types: ischemic stroke, which is also called a brain infarction, or a hemorrhage stroke, which is bleeding inside the brain. Brain infarction will occur when the blood vessel supplying the brain is blocked, leading to insufficient oxygen and nutrition delivery, and ultimately cell death. Causes are atherosclerosis, thrombus formation, emboli from the heart, for example from atrial fibrillation, or small vessel disease, which is also called lacunar infarcts. Imagine the brain's blood supply as a highway. If there's a roadblock, or in this case oxygenated blood, it cannot pass. Within minutes, neurons deprived of oxygen begin to die, forming an ischemic core surrounded by the penumbra, which may be saved if treated quickly. Symptoms are based on the fast mnemonic: facial droop, arm weakness, speech difficulty. If one of these occur, it's time to call emergency services. Diagnosis is made by a CT scan to exclude hemorrhage, or an MRI, which is more sensitive for ischemia. The treatment options are intravenous thrombolysis, which is used within 4.5 hours, mechanical thrombectomy in large vessel occlusions, and secondary prevention, which is antiplatelets, anticoagulation if the patient has atrial fibrillation and lifestyle changes. A brain hemorrhage occurs when a blood vessel ruptures, causing bleeding directly into or around the brain tissue. There are two types. One is intracerebral hemorrhage, which is bleeding inside the brain tissue. And you have subarachnoid hemorrhage, which is bleeding into the space around the brain, and which is often caused due to a ruptured aneurysm. Causes are hypertension, which is also the most common cause of hemorrhage, aneurysms, arteriovenous malformations, trauma, or anticoagulant use. When a vessel bursts, blood accumulates and increases intracranial pressure. This compresses nearby brain tissue, disrupts normal circulation, and can quickly become life-threatening. Symptoms are sudden severe headache, nausea, vomiting, altered consciousness, or focal neurological deficits, depending on the location of the hemorrhage. Diagnosis is made by a non-contrast CT scan, and the bright white areas in the brain show acute blood. Lumbar puncture if subarachnoid hemorrhage is suspected but the CT is negative. Treatment is based on stabilizing the airway, breathing, and circulation, reverse anticoagulation, lower the blood pressure but carefully, and neurosurgical intervention like clipping, coiling, hematoma evacuation, or decompression. If we look at the key differences between infarction versus hemorrhage, we have a difference in cause, onset, symptoms, imaging, and treatment. Both types of stroke are medical emergencies. Ischemic strokes can sometimes be reversed if it's treated quickly, but hemorrhage strokes generally carry a higher risk of death. Prevention is the key. Control your blood pressure, manage diabetes and cholesterol, stop smoking, anticoagulation and atrial fibrillation were indicated, healthy lifestyle choices. So in summary, brain infarction is due to blockage, brain hemorrhage is due to rupture. Both can be devastating, but quick recognition and treatment save lives. Thank you for watching Files and Beyond. If you found this helpful, don't forget to like, subscribe, and share this video with fellow students, nurses, or doctors. See you in the next one.